Certainly, I usually sit in San Francisco, and a lot of the VCs and founders I talk to believe that healthcare is one of the most exciting spaces for AI disruption. Where are we seeing that disruption now at the earlier stages, and what's the opportunity?
Yeah, great to be with you. I think we're going to see it all over healthcare, both on the demand side, how consumers and employers interact with healthcare, and on the supply side, how we deliver healthcare more efficiently. Healthcare is a fifth of the economy, close to a fifth of the economy in the US, about 11% of GDP globally. So it's a massive opportunity. And really, consumers are struggling getting access to care. And then on the supply side, we're having a struggle finding labor and clinicians to get easy access. So automating a lot of healthcare is going to be really, really important as we head into the next decade.
Now, traditionally, though, healthcare has been a really tough industry to disrupt. We've seen the tech giants try and do so, from Amazon to Apple to Google with Verily. Is that changing? How is that going to change in the age of AI?
I think it is changing because I think we've learned something in these last few years with the first batch of, if you will, digital disruptors. In healthcare, we often have to disrupt from within. We have to understand that we have commercial insurance and governmental programs, Medicare and Medicaid. We have FDA, we have privacy concerns. So as we apply technology, we need to overlay this technology on top of this infrastructure. And we're seeing a batch of companies do that now. Just as an example, I'm involved with a company, Ezra, that uses AI to accelerate MRI scans, so reduces time in scanners. And it's received FDA clearance. Or these other couple of companies, Octave, which connects people with therapists who take insurance. And recently at Cigna's Investor Day, they announced a big relationship with Octave. Or Amai is a program for serious mental illness that connects patients with serious mental illness with insurance in a clinical model. We're also looking at some really interesting company to automate on the supply side, looking at a company now that can help clinical researchers look for grants, normalize their data, and use large language models to apply for those grants. So these are all examples of companies, I would say, disrupting from within the ecosystem.
When we sort of look really broad, how AI, and the application so far has been chatbots, is going to affect people, affect humanity. There's this question of, is it going to make people more or less lonely? We couldn't have sort of seen all of these unintended effects of social media either. So I wonder what you think the impact is going to be on mental health.
Well, I think a few things. I think today, if you try to interact with the healthcare system, can you get somebody to answer the phone? Can you get a response if you have a question? I think these front-end aspects of interacting with healthcare, checking my insurance, checking for availability, I think those are things we can automate. The care, the compassion, the behavior change, I think we'll leverage technology, but this is where we hope to make humans more productive and give them more time and space to interact with people. So I think of itself, it shouldn't be a detriment, but we have to manage.
For sure. I do want to ask you, because you sold your company to Amazon. It was one of Amazon's biggest acquisitions, One Medical. And Amazon itself has sort of this mixed record in healthcare. And I wonder, what do you think it ultimately wants to do here? Does it want to get into the employer healthcare market? Because so far the success has been mostly on the consumer side.
Well, I think Amazon looks to problem statements where there is a significant gap between what people want and what's out in the marketplace. And if you look at the combination with One Medical and Amazon, One Medical had a membership subscription program that combined digital health and in-person care. And Amazon had a membership subscription program. And so that was a very nice combination. I think the other interesting thing about Amazon is Amazon can combine great technology, if you will, the AWS side of the house, with logistics. And so at some level, it also has a long-term perspective. So it's willing to work through things in the long term. So I think Amazon has the kind of capabilities, the long-term perspective, the consumer focus, the ability to combine logistics and technology that's quite unique.
The Amazon flywheel. We could put it like that, too. Thank you so much.